Is that better? Okay. For some reason, these webcams don't like me very much. We'll see. All right. So is everybody excited? You ready to go? Got lots to do today. So we're getting ready. Turn on your cameras. Let me see your shining faces. A couple of people I think are having internet issues, so they'll be jumping in and out. Finish letting in these last few people. Good morning, Whitney. Make sure you sign into the chat because that's how I verify attendance. If you are not signed into the chat, you may not get attendance counted. And then you'll get nasty phone calls from the dean saying, why aren't you attending class? Okay, if everybody can turn their cameras on so I can see you. Sharita, Lindsay, Ani, Danielle, Jessica, can we turn on your cameras, please? Good morning, Heather.
Good morning.
So I see you're in uniform. That looks good. You all look very nice this morning. Good morning, Danielle. Can you turn your camera on? Lindsay, can you turn your camera on? Jessica? Cullen, can you turn your camera on? All right. So welcome to PNR 104. You made it. We got to the first class. Y'all got on Zoom. How are you doing on getting into Canvas? Everybody in Canvas? And how many people took their, how many people took their technology quiz?
I didn't do that yet.
You haven't done that yet? Because that's very important because it's not going to let you into any of the modules until you get a 9 or above on that quiz. Okay, so if you got a less than 9 on score of 9 on that quiz, you're going to need to take it again. So, all right. So what we're going to do today, we'll take a quick tour through Canvas, talk about assignments, talk about quizzes, tests, etc. And then we'll get into content. We're going to talk about chapters 1, 2, and 3. So those will be included on your quiz next week. On next Tuesday morning, we will have a quiz, and it will cover chapters 1, 2, and 3. Okay, are there any questions yet? All righty. So let's get into Canvas. I'm going to share my screen, get my computer to cooperate here. Okay, now we can share our screen. I swear I need a mouse. My mouse is sleeping today. It's not liking me at all. So you can see that I also have the same technology issues you have. Now it woke up. Okay. All right. So this is what your Canvas looks like, right? Does it look familiar? Okay. So there's a couple of things I want to point out here. Starting with announcements. This is where I put information that is pertinent to the entire class. So there were 3 announcements to begin with last week. There will be at least 1 announcement a week to keep everybody up to speed on what's going on. Okay. So I asked you to review the getting started module and do the technology quiz. There is a list of workshops here that is very important. And then we talked about the Zoom tab, which apparently is not working. So we'll worry about that later. Okay. Let's go back home now that I can see my whole screen. So you see over here on the right-hand side of the screen, it says to do. Okay. To do lists everything that's coming up. All right. So when you have the little megaphone, that means you have a new announcement. All right. Your calendar will show you that there's something on the calendar you need to do. And then these NCLEX questions are due on January 29th at 8 p.m. Your NCLEX questions are due every Friday, starting in week 3, starting on January 29th by 8 p.m. Okay, we do not accept late assignments. So you need to have it in before Friday at 8 p.m. Don't wait until Friday at 7 p.m. to do it, because we have technology issues, things happen, and you don't get your assignment in. Turn it in on Thursday night if that's going to be a problem. Okay. So yes, we want to make sure that you know where to find the information on what's due where. One of the ways you can do that is here on your calendar, which is on the left-hand side of your screen. And everything I have put a date to will be on this calendar. So January 11th, term started. Okay, so we're in day 2 of the term. Your NCLEX questions are here. All right, your math homework will be due before your lab. So if you are on a Tuesday lab, they need to be done before 1 o'clock on Tuesday. If you're on a Thursday lab, they need to be done by 10 a.m. on Thursday. Okay, but your NCLEX questions are here. Let's see what's going on in February.
Sorry, what did you say the days for the labs were? Because mine doesn't even like show.
You don't know when your lab is?
I do not. Mm-mm.
Okay, I will check that for you in a little bit when we go on break, okay?
Okay, please. Thank
It's either Tuesday or Thursday,
you. Okay.
okay? So you can see where, you can look at your calendar and it'll give you an idea what's due when. Of course I can't do that. All right, that means I gotta get out of here. Okay. So leaving student view. So you guys know you don't have class next Monday, right? Next Monday, the 18th is a holiday. School will be closed. Okay. So,
I thought we don't have class on Monday regardless. So do we not have
oh, well,
class?
you don't have this class on Monday. I was just saying, if you have A&P or something, you won't have class on Monday.
Okay.
Yeah, no, this class is always on Tuesday. All right, so here are your modules, and this is how you need to navigate through Canvas every week. Let's see. Get this view to show up again. So first you had all your course welcome, and you had right here, it says you have to complete these items to go forward, okay? And one of those is the technology literacy quiz. All right, you need to get 9 or above, as I said on that. The next thing here, okay, you're gonna have your about your instructors, which is about myself and Miss Kaplan. It gives us a little bio. It tells you when your tells you when our office hours are, how to get hold of us, etc. It's over here. Okay, Ms. Kaplan won't be joining us today, but she will be here next week. And then you have our contact information, okay?
Good morning, Professor.
Yes. Good morning.
I don't know if I'm late or not. It says 8:30, but I've been trying to get in. Sorry to interrupt.
I've seen you come in and out a couple of times, so it's okay.
Yeah.
Okay, so is everybody on Canvas right now? Go ahead and sign into Canvas and get on Canvas for me. And even if your Zoom gets minimized, it's okay. I can still see you. So when you get on Canvas, I would like you to go to your modules. And when you go to your modules, go to the syllabus attestation tab. And this just simply says that you know where the syllabus is and that you got your Fortis online handbook, okay? So if you click on that, It pops up like a quiz, but it is not a quiz. Okay, Arjanika, we'll talk here in a little bit in the break, okay? Figure out that. So if you go in to do your quiz, and it only has one question. And it says, I have reviewed the syllabus in the student handbook understand my expectations. True or false, and hit submit, and that'll be done. Is everybody finding that?
I can't find mine.
Have you done your technology quiz?
Yes, but I needed like half a point more.
Okay, if you don't get 9, it's not gonna open up. So you're gonna have to go back and do your technology quiz again and then do this, okay?
Okay.
So.
Hi, I have a question.
Yes,
I did my quiz and I got a 9.5, but I don't see where you're at.
okay, it should be on your dashboard. Let's see.
Dashboard.
It should be under your course welcome. Does everybody else have trouble seeing it, or can you? Oh, wait a minute. Let's try this. It works better if I publish it. All right, it should show up now. You may have to refresh. Okay. Better now? All right. So when you get your modules open, your modules for week 1 is here. You have an overview. It will explain everything we're doing in week 1, including what happens in lab. Okay, we have our course objectives and our to-do list. All right. If we go to the next page, I believe. We go to the readings for week 1. So it's chapter 1, 2, and 3.
Sorry for the
Yeah.
interruption, but I'm not getting access to the syllabus. They are saying access tonight.
For modules,
Yes, and my internet is really giving me some troubles. Like I'm just in and out.
okay. Well, if you have a lot of people working on the internet in your house right now, you may be having some problems. So if you can
Yeah,
kick some
that's
of them
true.
off.
Exactly, that's true. I think that's
You may have
all.
to kick some of them out. You may have to get yourself a hotspot. Okay.
All right.
If you have not completed your technology quiz, you're not going to be able to see this module.
I completed it already.
Did you get 9 or above?
Yeah, I did it several times, and yeah.
Okay, you're still not seeing modules week 1?
No. No, I see modules. I see get started. I see week 1 the lesson, but I'm not seeing the quiz. When I go to syllabus, they say access denied.
Okay.
I'm sorry for the distraction.
All right, well, we'll work on that in a little bit. So it's not essential that it finishes right now, but if we go back to week 1 readings. It's going to show you what is due, what we're supposed to be looking at before class, because remember we have the 3 B's: be on time, be prepared, and be engaged. Okay, the 5 chapters we're working on in Math and Lab. It gives you a copy of the PowerPoint, okay, and PowerPoints to go with the math book. Also, you'll see these evolve questions here. These are not mandatory, okay? These are just for your studying, you're preparing for the class, etc. So every week has evolve questions that you do not need to do. What you do need to do is your Saunders questions, which is back down here in week 3, but that's not it. All right, another way to get your assignments is to go to syllabus. Okay. We went over the syllabus. It's here if you would like to, download it and read it. This is your roadmap to this class, okay? But it also has everything that is on the calendar and everything that is on the syllabus here. So if we go to January, come back. We have a lot of people on the computer here too today. Okay. So if you look at January 29th, okay, NCLEX questions from Saunders. Click on that. Okay, it tells you what the assignment is, okay? 25 questions, and we'll go through this in a minute, and it'll give you the subcategories that you're supposed to check in order to get your questions, okay? After you've done your questions, and I don't care what your score is, all right, but you have to remediate, all right? Any questions you did not get right, we need to remediate, which means we're looking at the question, figuring out why we didn't get it right, and writing a little blurb, like 1 sentence about what you learned from looking at this question. So that the next time you see these questions, because you're going to see a lot of these questions again, you will be able to answer it, okay? So I am going to go to my Saunders book, and I'm going to get there through modules. If you go to student resources, now we are not going to use Evolve. We are only going to use Canvas, okay? So on your resources, you have a lot of things to help you with Canvas. You have exam soft information, who to contact for what, your Zoom resources, all kinds of information here. But here are your books. Your DeWitt Fundamental Concepts and Skills, which is this book here. This is your main textbook, okay? Got the space on it, but this is what the textbook looks like, okay? And then in your resources or your references, you have Calculate with Confidence, which is the pink book. This is for lab for math. And then your clinical nursing skills book, which is your lab book. We use this for lab for our skills. Okay, so you have 3 books we're going to be using frequently. And then your Saunders is here in your reference package, and this is what you're going to use for your NCLEX questions. All right, you're going to load that. If you have not gotten in here before, your book looks like this. Okay, NCLEX PM for the examination. This is your Saunders book. And on the inside of the front cover, down here at the bottom, there is a scratch off. And that is where you get your access code. If it asks you for an access code, it's right here on the inside front cover of your NCLEX PN book. Okay. Once you put that in, you're going to get this screen. You're going to go to quiz. This gives you a little overview of what you got, and then you're going to click continue. So step one is to select, and we're going to select 25 exam questions. Our category this week is priority concepts. And then we will be these little carrots next to the boxes. All right, they open up more boxes. So we're going to go to professional nursing and healthcare concepts. And then we're going to open up attributes and roles of a nurse. And then it is health promotion and professionalism. Okay. So now we have 25 questions about those two topics. We're going to begin our session. So question one, the nurse determines that which individual presenting to the clinic is at greatest risk for development of an integumentary disorder. All right. So the answers are an adolescent, an active elderly client, a physical education teacher, an outdoor construction worker. So what do you guys think? Who do you think is at most risk to develop a skin disorder?
Now, door.
Okay, I got elderly.
Yes.
Everybody say elderly. Okay, we will check elderly.
Yeah.
We'll submit it. Move on to the next question. When you take blood pressure on a school-age child, where should the nurse place the blood pressure cuff to obtain an accurate measurement? All right. So 1/2 the distance between the antecubital fossa and the shoulder. 1/3 the distance between the antecubital fossa and the shoulder. 2/3 the distance between the antecubital fossa and the shoulder. 1/4 the distance between the antecubital fossa and the shoulder. So what do you guys think? You're putting a blood pressure cuff on a school-age child. DeConte says 1/4. Tawana says 2. Davina says 4. Okay. So we got 2 4s here, so we will click on 4 and submit. And you go through this to do all 25 questions, okay? When you're done, you want to go to home. And since if you're going to leave it in the middle, you can just say suspend and come back to it. Or you can end and tally the session if you've done all 25 questions. All right, once you're back here, you go to history. And here are the questions we just did. All right, and here's our score. And gee, we were 0 for 2. So we have a 0% score. All right, you will eventually have to get 78% on this, but right now 0 is fine. It breaks down what kind of type of questions you had, what type of, like we had one question that was about skin, one was about musculoskeletal. Okay. But the big part here I want you to do is I want you to go to review down here at the bottom. And it's going to give you your incorrect, and it's going to tell you whether your answer was correct or incorrect. Okay, the answer was actually an active elderly client. We picked active elderly client. The answer was actually an outdoor construction worker. Well, why was that? Let's go to the rationale. We have prolonged exposure to the sun, unusual cold or other conditions can damage the skin. Okay. It's usually it's an elderly person, but this is an active elderly. All right. The adolescent may be prone to acne, but that does not occur in all adolescents, not in my experience. And then the phys ed teacher has very low risk. So your answer would be the outdoor construction worker because they have prolonged exposure to the sun, cold, or other conditions. So you're going to write on a separate piece of paper, prolonged exposure to the outdoor construction worker because of prolonged exposure to the sun. Okay. Put Connie back in here. All right. And then we go on, we go to the next one. All right. The answer was 2/3 the distance. We picked 1/4. All right. Why is that? The size of the BP cuff is important. Cuffs that are too small will falsely cause elevated values, etc. All right. So you're going to answer your questions. Everything you got incorrect, you need to give me a 1-sentence blurb on why the answer is correct. Like, give me the rationale of why the answer they want is correct. Okay. And then you're going to go, you're going to get into your history. You're going to says print results. You want to print this to a PDF. So I'm going to click. Save as PDF. Save it somewhere you're going to remember it's at. And then we're going to go back here to our syllabus. All right, go to our questions. And on your screen, because it's not going to tell me on this one, see if it'll go this time. It should have a box to download it to. It says submit assignment. So you would submit the assignment. And upload your document, your results page and your remediation. Okay. And every week we have different categories, and every week you need to do remediation. All right, are there any questions on how to do NCLEX questions?
You said these are due every Friday or Thursday?
Friday at 8 p.m. is the absolute cutoff, okay? I recommend having them done by Thursday, but that's just me. I would have them done ahead of time.
Starting in week 3, right?
Start due January 29th. Okay. And you'll notice that over here on your home page, they should pop up. Okay, and collects questions from Saunders, January 29th, right there. Click there. It's another way of getting there. Okay. So there are multiple ways to get there. You should be able to submit from this box here. And then the other thing on this page is your grades. So, there's always a question, did you get mine? Did you submit mine? I submitted mine, did you get it, etc. If you go to your grades page, it'll lay out everything that needs to be submitted. Okay. And it'll have a little, like a sheet of paper looking here and or a score, depending on whether I've graded it or not yet. All right. And so you'll be able to tell here whether you've turned it in, whether it was late, whether it was complete or incomplete. Okay. You'll be able to get your status here. Any questions? Oh, good, Michaela. Good. You can type in your remediation, you can write them, just if you do a Word document, you can submit it to the same box that you submit your NCLEX results to. Okay, it's going to take you a minute to get it all figured out, but once you do, you'll be fine. And you can always ask questions. In last resort, if you cannot get it to print to a PDF, please just take a screenshot where I can see the date and the entire first page of your work along with your remediations, okay? So any questions about Canvas? Does everybody know where to find everything? At least for today, huh? All right. Let's stop the share here, get you all back on the page.
So sorry, I was trying to get to ask some questions when you were asking.
Yes.
So basically, as I said, my internet is giving me some troubles here. But when it comes to getting a resource from Evolve, are you getting me?
Yeah. So the resources,
Yeah, I didn't get that part clear.
okay, the resources are on your Canvas and your modules. So if you go to modules, you should have something called student resources.
Mhm.
And that's where all your textbooks and other resources are listed. You just
Okay,
click on what you
very
want.
quick. Mhm. Can I get access to the recording after the class?
Yes, absolutely.
Okay, that would be great. All right, thank you.
Okay.
Mhm.
Anybody else? All right. So those of you who did not finish the technology quiz, if you could go ahead, and I'm going to have you do that now.
I do have a question. I'm sorry.
Yes.
As far as like the questions that are in that goes with the fundamental concepts and skills for nursing book,
Yes.
you know that you have two different books. So like for the questions that's in the chapters, are we supposed to do them?
Yes.
Okay.
You'll have to do the chapter questions at the end of every chapter in the book.
Okay.
And we're going to do that because that's the best way to study for the quizzes.
Okay, because I that's what I started to do, but I didn't know for sure.
Okay. You also have a study guide that you can use to help you focus your reading and to help your critical thinking. That is optional.
Okay, and where's
Your
that
study
located?
guide is optional. I'm not asking you to turn any of that in. It's a good idea because it helps you focus. Okay? Anything else? All righty. So it is 20 to 10. I'm going to start class. No, we don't turn in the book quiz. I'm going to give you guys a break. You can finish your technology quiz. You can finish your syllabus attestation, those kind of things. And those people who have issues, we'll work on those right now. Okay. Start class again at 10, and we will get into the contents of chapter 1, 2, and 3. So you can take a break if you've got everything else done. If you need you have issues and need help, stay on and we will work on them. Okay. So Arjanique.
Professor Novak,
Yes.
do we
Keith.
have a passcode this
For
time
what?
for the Zoom?
Y'all. Find it. Okay, the passcode is 5X855P, all lowercase letters. 5X like an X-ray, 855P is in Paul. It's always a good idea to make flashcards, always, because you can carry them around with you. You can study them all the time. All right. So,
Thank you.
Arjanique,
Yes.
what's going on with your Canvas?
Okay, so I logged in using my old login from when I was in the other program, and it pops up that I'm not registered for no classes.
Okay, are you going to the Fortis.in structure website?
No, let me see. You said in structure?
INSTRUCTURE. Fortis.in structure.
Okay, let me put it back.
Let's see, I put that in the chat.
Okay, 301 64 3907. Yes.
So do I make a new, like set up a new,
Right, if you're in the Fortis.in structure, you need to go to forget password, put in your Fortis email is your username, and then forget password, and it will send you a new password to get in.
Morning, Mrs.
Good morning.
Is the class cafe where we're doing the discussions that we have to post for the attendance?
No, we don't have to post attendant discussions for attendance in this class. That is just for you guys to chat. Somebody has an issue, somebody has some brilliant idea, put it in there. Okay?
Thank you.
Somebody says they want to create a WhatsApp group. That's always a good idea too. So Fat Two's talking about that. You can get hold with her.
Hi, Professor Novak.
Hi, honey.
Hi. This morning I saw the Zoom link for the course, but now I can't see it. So I was having trouble to come back. It says nothing like the meeting Zoom when I click. I don't
Okay, so
see
you need to go into that, register, and then it should have given you another link to get into the class.
Okay. Thank you.
But I'm glad you made it.
Thank you.
Okay, is there anybody else having any other issues with Canvas? Sharita, I see you haven't gotten into your Canvas yet, if you're there. If you need help, let me
So,
know.
so with the involve, we sign with our student email and create a new account.
Yes. Sharita, what?
Should we sign to involve with our student email?
Hold on one second, Fatu. Sharita?
I got into Canvas already.
Okay, thank you. So what was the question, Fatu?
I'm saying, should we sign to involve with our student email?
For Evolve yet? No, you have a username and password for Evolve, but you really shouldn't have to sign into Evolve. Everything you need goes through Canvas. It may take you to the Evolve site there. Okay, but
Yeah.
you shouldn't have to sign in.
So where should I go?
For what?
I'm trying to access the questions that we were reviewing
The
earlier
NCLEX
on.
questions?
Yes.
You're gonna go to your student resources on Canvas.
Yeah, student resources.
All right, click on the Saunders book.
I'm just seeing who to contact, Zoom resources, how to register for exam stuff, the illustrate resources, online resources, reference.
Reference,
Student.
look under reference.
Okay.
Starts with Silvestri, Saunders, comprehensive review for the NCLEX PN.
So what here is due date, point, submitting, that's why I'm not student resources.
You want to share your screen with me?
Yes, I will do that. Am I sharing my screen with you?
Yes. So show me your
Okay.
Canvas.
Basically here I am.
Okay, so let's see here. All right, so we have Canvas resources, textbook, Evolve student resources, and then reference package. The third one there says Saunders Comprehensive Review.
No.
Yeah, I'm
not
seeing
seeing
it right there.
This?
Right here. I don't know if you want go to, yeah, okay, so you got your clinical nursing skills, your drug calculations, and then Saunders Comprehensive Review.
Okay.
Click on that.
Mm-hmm.
All right, so
So when I
click on
click
the
that here,
load,
it takes me-
click on the load it. All right, so put your email address in, your student email.
Mhm.
All right, hit continue.
That's me for the password.
All right, do you know, if you don't remember your Evolve password, then click Forgot Password. Have you been in Evolve before?
Yeah, so I have involved account before, but that was not with Fortix at the Hesse with Chimoda University.
Okay, so you probably need to start a new account then.
Yeah, that's why. Should I have a new account?
Yes, go ahead and
Create a
start
new
a new
account.
account. So go back. and-
Create a new account.
Yes, there you go.
But it asked me to
So
redeem
now it's
access
asking
code.
you for the access code, and the access code is for the Saunders book.
Okay, let me get it quick.
All right, Janique, did you get in?
No, it's actually, wait, it said it takes up to 30 minutes to get the.
Okay, so you're waiting for your password. All right,
Yes,
good.
and I tried this last night and it never sent last night either. So I'm not sure if it'll send this morning.
You looked in your Fortis email, right?
Yes.
Okay.
This is the book, right?
I can't see you. Where are you?
Is this here supposed to scratch?
Yeah, on the front cover.
Okay. Thank you.
You know, on the modules, we're supposed to do the readings. When it comes to the lab stuff with the math and the calculations, are we supposed to do that work in advance too, or is that going to be
No,
done?
no, we'll talk about the math in lab. We will go over the math in lab, practice it, and then you will have homework assignments to go with it.
Okay.
So I think I got it.
Oh, it's the wrong book. I'm sorry, your
Yeah,
camera's
so
off. Okay,
okay, so where should I go? My camera is off. Oh my god. But are you still seeing my screen?
okay, that's the
Professor?
Hesse book. You want this? No, your camera's.
My computer, I don't know what's happening to the internet.
off. Your camera is off. Have the process down, okay?
Okay, so where do I go next? Show.
So
Okay,
you would go to
Zafar,
redeem.
okay, redeem. Thank you. Put my email.
Okay.
So my email that is registered with involved is the email, my personal email is not, my school email is not true.
Okay, Texas or Jacob, and they will help you with that, okay?
Okay,
But
thank
you
you so
have the
much.
process for getting the book
Yeah, I
in.
got it. Yeah, thank
Okay.
you.
Okay. All right, stop sharing.
Okay. So I still sharing?
No sharing. If I can get you out of here.
Thank you so much.
There you go. Okay. Any other questions? Okay, well, I'm going to take a quick break, get something to drink, and I will be back in 5 minutes, okay?
Okay.
Yay, I'm back. Okay, sorry guys, I was having Zoom issues. Did not want to let me in. Okay, so we ready to go? Cameras on? Okay. So we're gonna start talking about chapters 1, 2, and 3. Now, one of the ways you can do this is when we go through the PowerPoint. You know, if you would highlight, see in the book with what I say. Now, so I'm not going to guarantee it's all going to go in the right order. You know, if you notice something in the book that correlates with what I'm talking about, then that means it's important enough to know it for the test. And we will get. There you are. You guys are too quiet. You got to talk to me. Okay. Okay. So, chapter 1 in nursing. As soon as men decided to take care of each other, nursing started. Okay, you can see okay. You know, there are instances in the Bible of people being nurses. So, but the nurse that we follow most closely is good old Flo. Florence Nightingale is the mother of nursing. Okay. And why is Flo different than everybody else? Well, Flo is different from everybody else because Flo decided to start using evidence-based nursing, basically. What she did, she was in the Crimean War. The conditions there were absolutely deplorable. There was raw sewage running down the middle of the floor. There was no ventilation. The nutrition was horrible. Okay. And so she decided that, you know, in order to get people better, we need to clean up the wards. We need to feed them better. We need to give them fresh air. We need to give them activity. All right. When she started all this, there was a 60% mortality rate at that hospital, meaning 60% of the people in the hospital died. Okay. After she did on just her ward, getting some good food into her patients, huge. She kept notes. She followed procedures. She did this systematically and scientifically. Okay. And then as she's, you know, progressing through, you know, taking care of these patients, she decided that nurses were not getting trained adequately. So she started her own school of nursing. And one of the things in her school of nursing was that nurses should teach nurses up to this bedside, and they were just teaching them what they wanted the nurse to do for their patient. So if you had a patient with a dressing change, you learned how to do a dressing change. If you had a patient with that needed some kind of breathing treatment, then you learned it at the bedside. If you were lucky, otherwise you didn't learn what you needed to know. So Flo started a school with nurses teaching nurses. And that's where we come to our nursing schools today. Every one of your professors is a nurse. Okay, and we continue that tradition. Okay. Your nursing practice is defined by your Nurse Practice Act. This gives you the scope of your nursing practice. It is a state law. The Nurse Practice Act is actually in the laws of the state of Ohio, okay? The Nurse Practice Act developed the State Board of Nursing that reports to the Congress, okay? It defines what nursing is for the RN and the LPNs, all right? And it was developed to protect the public. All right, we have this Nurse Practice Act to protect the public so that all nurses are following the same rules. Okay. Every state has its own Nurse Practice Act. So the Nurse Practice Act in Ohio may be different from the Nurse Practice Act in Indiana. Okay, the Nurse Practice Act in Pennsylvania is definitely different than the Nurse Practice Act in Ohio. Some states, LPNs cannot do anything with an IV in Ohio. So, and every board of nursing has their own regulations about what you have to learn in school. So this is how the Nurse Practice Act kind of affects you right now. Practice standards. And if you look in your book on page 845, you will find the National Federation of, it's in Appendix B. And this gives you an idea of what it is you need to do as a nurse, okay? It tells us what the scope of your practice is. It tells you what kind of education you should receive, that you have to follow you have to pass the NCLEX for practical nurses, all right? You're gonna get orientation when you get a job. It has the legal ethical status, okay? So, you know, your scope of nursing practice is authorized by the Nurse Practice Act. You have personal commitment to fulfill the legal responsibilities inherent in good nursing practices. You have a commitment to meet the ethical obligations of the practice of nursing. Goes on to what your practice should and not do. It includes your part that you in the nursing process, which we'll get to in a minute. Continuing education is important for all nurses. Once you get out of school, you're not learning. You have to take 24 hours in Ohio, 24 hours of continuing education to renew our nursing license every 2 years. Okay, nurse for a year. Nurse standards, because this is what you're going to be working under. Okay, apparently we're having, can you guys see and hear me now?
Yeah.
Okay, good. Where did you lose me? Did you hear about the the NF, National Federation of Licensed Practical Nurses Standards? Did we get through those? In Appendix B?
I heard a little bit.
You heard a little bit. So page 845 in your book. These are the standards that you'll be practicing under in addition to your nurse practice acts. So as a licensed professional nurse, these are things that we, so obviously you need to complete your education. You have a legal and ethical responsibility to have a current license to practice nursing, which means you need to renew it every 2 years. We have a commitment to fulfill the legal responsibilities inherent in good nursing practices. You have to take responsible actions while you're in a situation. And report unethical professional behavior by a peer. Okay. It has a long section of what your practice will look like and what your part in the nursing process will be. That you need to continue your education after you get to school, and that there are some specialized nursing practices you can take part in after you've been a nurse here. Okay, so read those because those are going to be very important to you in the future. Do we hear now? Okay. So I'm sorry if I'm breaking up. I apparently have a really bad Zoom link today. I've been bounced out twice now. So you see, it's not just you guys that gets bounced out. We get bounced out too. All right, let me get my back up here. I'm gonna try and get on my phone and see if that'll be better audio for you. All right, I have to get the code again. So, yes, Chandra, we will talk about that. Whether, you know, we have obligations outside of work, yes. And as long as you're following your Nurse Practice Act standard, not get in trouble for helping a friend or family member. Let's go to 927. Okay, can you guys hear me now? 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 Stop. Stop.
Yes, but you have an echo going on.
Many times, yes. Let me turn off the sound on this. Many times, yes. Let me turn off the sound on this. Many times, yes. Let me turn off the sound on this. Oh my goodness. Many times, many times. Can you hear me now?
Yes.
Is that better? All right. Strauss. So, licensure. I didn't mute this. All right. Licensure is determined by your state board of nursing. They're the ones that say you can have a license. I'm sorry, is there a horrible echo?
It's not so bad.
Okay.
Yeah,
good.
it's not too bad. It's a little bit, but it's fine because we can hear you.
All right. Sorry for all the technical issues today. Turn this one down, maybe. Okay. So, and every state has a representative on the National Council of State Board of Nursing, or the NCLEX committee, all right? The good news is that if you pass when you pass the NCLEX, you only have to take it once, all right? You only need to take the NCLEX one time. Now, if you go on for your RN, you will have to take another NCLEX, but you only have to take the NCLEX PN once. It's accepted in all states as one requirement for licensure. Okay, so that's the good news. The bad news is that you're going to get your license in Ohio, all right? And there is no reciprocity or nurse compact in Ohio. In Ohio, if you have a license from another state, you're going to have to apply and get an Ohio license, which they will give you if the state you're coming from determines that you are a nurse in good standards and you pay your money and get your license. Other states have reciprocity with each other, like West Virginia and Kentucky. You know, if you have a West Virginia license, you can work in Kentucky. If you have a Kentucky license, you can work in West Virginia without getting a new license. And then there are licensure compacts out there where there's a group of states that say, if you have a license in Colorado, you can work in California and Wyoming and Wisconsin and Mississippi, you know, a whole bunch of states. Ohio is not part of any nurse licensure compacts. And the Board of Nursing will let you know if you're interested in where you know, obviously your Ohio license isn't going to go anywhere either. You can only practice in Ohio. So you can go out to whatever state board of nursing you want and find out where you should get a license from that you can work in that state and other states too. I know several students take their licensure exam in California through the California Board of Nursing so that they can have that flexibility. Or they're planning on moving to California or Florida, so they just take their licensure exam down there. It's the same test, no matter what state you take it in. Okay?
What about like a travel nurse? Do you have to get your license in wherever you're going for that short period of time?
Yes, you do. You need to have a license for every state you work in. So, you know, if you work for a travel company, hopefully they'll help you pay for all those licenses that they want you to work in. But once you get them and you keep renewing them every 2 years, you don't have to, you know, reapply. So, nursing is an art and a science. There are 4 common goals for all nurses in nursing. All right. First thing is to promote wellness. First goal, promote wellness. We want to avoid people getting sick, right? So we're going to promote good, healthy diets. We're going to promote vaccinations. We're going to promote social distancing and mask wearing and hand washing. We're going to promote wellness to prevent illness. We also work to facilitate coping. Your patients are under a lot of stress, and it's up to us to help them cope and manage their way through this situation they're in. And then finally, it's to restore health by giving medications, doing treatments, things like that. We talked a little bit about evidence-based nursing. It is the science of nursing, as you know, nursing is an art and a science, right? So evidence-based nursing is the science of nursing. And basically what that is you look at the research. So if you are having an issue with skin breakdown on your unit or urinary tract infections, okay, you go out and look at the research and see what other places have done to decrease the number of skin issues or decrease the number of urinary tract infections. And you gather your evidence and you discuss it with the people on your unit, and you guys decide what your plan of action would be. And then you scientifically do that plan of action. Say, let's say on all the even beds, we do this, and all the odd beds, we do that. And then we gather our evidence at the end and we evaluate it, which one worked better. And then we write policies and procedures related to the science and the evidence that we just came up with, okay? And then interventions are part of your nursing, and those are actions taken to improve, maintain, or restore health or prevent illnesses, okay? So when you hear the difference between implementation and interventions, basically it's the same thing, but interventions are your actual actions. Nursing has its own framework, and it's called the nursing process, okay? And your nursing process has 5 steps to it, and we call it ADPI, A-D-P-I-E, ADPI. And what that is assessment. We have to, before we make any decisions, before we take care of anybody, we need to look at them, right? We can't work blindly. So assessment is the first step of the nursing process. The second step is a nursing diagnosis. This is totally different than a medical diagnosis. This is basically the nursing problem you're going to take care of on this patient. So a patient may have a diagnosis of pneumonia, but that's not what you're going to do, right? What you're going to do is help them breathe better. So they may have a nursing diagnosis of ineffective breathing patterns or blocked airways, okay? Ineffective airway clearance. So then our interventions will be based towards fixing the nursing problem that we have. Planning is just A, planning on how you're going to do it, and B, what is your goal? Is your goal for your patient to breathe better, right? Implementation are your interventions. What are you doing? And you implement your interventions. And then finally, we evaluate our care to see if our plan is working. If our plan is working, we continue it. If it's not working, then we're going to go back and look at our interventions again and see what we can do to change it. We never change our goal. The diagnosis is not going to change, okay? We will reassess and re-implement in order to get our patient better. So the nursing process, ADPI, A-D-P-I-E, is very important in nursing, and we will have a whole class on that coming up here. All right. There are different models of care for nursing. Long time ago, we started off with functional nursing care, which means that the nurses just performed a series of tasks that they were told to do. This is very fragmented. Every physician would have their own tasks. Every patient, you know, Every nurse would have their own way of doing things. So it was very fragmented, but it was cost effective because it was cheap for everybody. All right. Then we moved into team nursing where we had an RN team leader and they assigned tasks to the PNs. All right. And this is a good way of doing things. In fact, I believe Ohio Health is going back to this. They're starting to hire practical nurses to be on the team with the RNs, to let the RNs be more of the care planner people and the PNs to actually do the hands-on nursing. Okay. The only way team nursing works is if you have excellent communication. All right. You have to be able to talk. You have to have a strong team leader. Another model of care is your total patient care, where we have one nurse who carries out all the functions. They do the nursing part. They also do whatever an aide would do. They do the social worker part. They do everything for the patient. So the care is less fragmented because we only have one person taking care of the patient, but that's very expensive to maintain because you have to pay a nurse for every couple of patients. So instead of having 1 or 2 nurses on the unit, you have 6 or 7 nurses on the unit. All right, primary care nursing, where we have one nurse who plans and directs the care of the patient. It's a lot like total patient care, but they're not doing all the care. They're directing other people to do the care. So you have a team. And then patient-centered care is what we always strive to do, which is where we're treating the patient as a whole. We're looking at their medical, their psychosocial, their emotional care, as well as their physical care. All right, when somebody gets sick, there are different stages that they go through. The first stage would be the transition. Yes, I will send out this PowerPoint. The first stage would be the transition stage, where kind of have malaise. And malaise is, okay, malaise is just that non-specific lethargy. Okay. So the first thing is malaise. Your transition stage is malaise, M-A-L-A-I-S-E. Okay. And it's just that vague, non-specific symptoms. You just, but you kind of get into denial. You deny that you're sick. You're just feeling kind of off, but you're not sick. The second stage would be your acceptance stage, where you actually acknowledge that you're sick. You start taking medications. You call the provider. You go to bed. You start showing illness behaviors, meaning you're doing things to get better. And the final stage is your convalescence stage, which is the process of recovering and regaining your health once you start to feel better. Once you're past the acute stage in the illness, then we move into convalescence stage. Okay? So the 3 stages of illness are transition, acceptance, and convalescence. Another way we look at health is Maslow's theory of basic needs. Okay? Maslow's theory of basic needs is basically this pyramid here, where we have on the bottom are physiologic. This is not psychologic. This is physiologic needs that have to be met. Okay? Once those are met, then the patient can start thinking about safety and security, love and belonging, self-esteem. And the peak is self-actualization. Okay? So what makes up those blocks? Okay? So we look down here. This is our physiological level. This is where you're going to be spending a lot of your time. The very first priority is this first block here, oxygenation and tissue perfusion. Okay? If your patient cannot breathe, then the rest of this doesn't matter. It doesn't matter if they're eating. It doesn't matter if they're peeing. It doesn't matter if they're pooping. If they cannot breathe, nothing else can happen. So oxygenation and tissue perfusion are the #1 priority. So we have 3 patients. One is having problems with urinary tract infections and they need an antibiotic. One is post-surgical and they need to be ambulated in the hallway. And one has been on multiple breathing treatments and their O2 sats are still low. Which patient are you going to take care of first?
The breathing treatment.
The one that's having trouble breathing, because breathing is essential to life. If you can't take care of the breathing, then they're not going to need anything else, right? So oxygenation is always your top priority. Oxygenation and circulation, which is your tissue perfusion. Then we could move into nutrition and elimination and safety, etc. All right. All these are basic physiological needs of everybody. Okay. And we need to take care of them all before we can start thinking about their assistance and meeting needs in their environments and their belonging and their affection and intimacy. All these need to be taken care of. All right. If you don't have if you're not safe in your home environment, then all this is not going to happen. Safety is important. Protecting your patient from injury, relieving their pain, making sure we have hygiene, and this is Florence again, right? Sanitation, hygiene, good nutrition, all these basic things. This is what she was talking about. So Maslow is very important when we're talking about prioritization, and it's something that you should get to know very, very well, okay? I can probably guarantee at least one test question about Maslow. And it will be something like how would you prioritize your patient care? Okay. Your patients are under a lot of stress. You guys are under a lot of stress, right? I mean, stress is normal. Well, not really. Stress is not normal. Stress is a physiological reaction to what's going on in your life. Okay. And you have what we call an autonomic nervous system, which means you have no control over this. And so we are in chapter 2 now. And if you look at, we're going to talk about on page 24. Your autonomic nervous system is on page 23. It's where your body automatically tries to get you into homeostasis. Have you heard about homeostasis in A&P yet? Possibly. I don't know if you've been in A&P. Okay, but homeostasis is that balance that the body wants to maintain health. Okay, so for example, if you are dehydrated and you have low blood volume, okay, your heart rate's going to increase because it's going to pump more blood around because there's less of it to pump. Okay, your blood pressure will decrease and your heart rate will go up so that the body can get more of what it needs. Okay, so your body will continually change in order to keep you in balance. What happens is once we get to that point where we can't keep it in balance, that's when we get sick. So if we look at table 2.2, we're talking about our sympathetic and parasympathetic actions. Okay, our sympathetic actions are our fight or flight type reactions. These are the things that help us when the bear is chasing us. Okay, when you get stressed out, your heart rate goes up, right? People's eye pupils get bigger. They dilate so that we can see things faster and easier. So imagine you're being chased by the bear, all right? Your pupils are going to dilate so that you can see everything around you much better. You can see farther. Your lungs are going, the bronchial tubes in your lungs are going to increase in size to get more air into the system to help you run away from the bear. So you'll notice people who are really stressed will breathe faster. Okay. Your salivary glands will start to dry up because really you don't need them if you're running from the bear. Your heart rate will increase. Your blood vessels will generally constrict and increase your blood pressure. Okay. That gets the blood farther into your body. It also helps if the bear catches you when they take a chomp out of you, the blood pressure, the blood vessels will be a little smaller, so the blood won't fall out, won't come out as quickly. Sweat glands will be stimulated. Your intestines will inhibit motility or mobility, because really, if you're running from the bear, you have no time to stop and go to the bathroom, right? All right. Your liver is going to stimulate glycogen, which is more like, it stimulates the production of sugar. Your liver will actually produce sugar for your body for energy. Okay. And then your adrenal medulla will kick in and start putting out epinephrine and norepinephrine, which are those stress hormones. Okay. So, okay, after the bear is gone and you're just sitting there all collapsed, then your parasympathetic system is going to come out and it's going to take down all those things that happened when the sympathetic system got it all wound up. Okay, so your pupils will constrict, your airways will constrict, your saliva will start flowing again, your heart rate will slow down. Okay, your GI system will start to get back into action, those kind of things. So sympathetic is when the bear is chasing you. Parasympathetic is at the end when everything's calmed down. Parasympathetic tries to reverse sympathetic. But both of those are autonomic. You have no control over them. So the signs, people who are under stress have some common signs and symptoms. Okay, I'm sure you've probably experienced some of these in the last month. All right. Dry mouth, rapid pulse, shallow breathing, sweaty palms, increased blood pressure, frequent urination, inability to sit still. Okay. These are all physical effects of stress. Okay. Your psychological effects of stress can be anxiety, confusion, irritability. So if you get yourself so stressed out about the test, okay, we're not prepared for the test, we're stressed about it, then you are going to have confusion and forgetfulness. And that's not going to help you on the test, right? Because all that studying is going to go right out the window because your brain is going to shut down because of stress. So we need to be able to reduce our stress in order to be successful, okay? Stress also leads to diseases and disorders. So you can see those on box 2.2 on page 25. Okay. Headaches, gastritis, asthma, back pain, ulcerative colitis, allergies, hypertension, cancer, Crohn's disease. These are all stress-related diseases and disorders. Okay. These are all things that will affect a person if the stress does not decrease. Now, there was a gentleman named Hans Saley, who was a Canadian physician, who came up with the general adaptation syndrome when it comes to stress. Okay. Your general adaptation syndrome is alarm, resistance, and exhaustion. So we have the alarm phase. Okay. This is, there is a stressor. Something has made you stressed out. Your autonomic nervous system is going to get activated, right? And what happens when that gets activated? What kind of physical changes do we see? I just went over this. What kind of physical changes do you see with the sympathetic nervous system?
Increased heart rate.
Right, good.
Dilated pupils.
Yes. Come on, guys. It's all on page 24.
Increased blood pressure.
Very good.
Sweat production.
Sweat production, yes. These are all these are all things that happen when that alarm happens. Your body goes, whew. Okay, and all of these sympathetic symptoms come up. Now, if that alarm does not go away and you continue to have the same stressor, Then your body is going to get into the resistance stage. And this is when your endocrine system is activated. It's providing a secondary defense. All right. So epinephrine, norepinephrine, cortisol, all those stress hormones are going to come out and they're going to affect your body. And you may think you're handling things very well, but if the stressor is never relieved, then you will get into the exhaustion. Your defenses will be exhausted. There will be no homeostasis. There cannot be any more adaptation, and death will occur. So you can actually stress yourself to death.
Wow.
Yeah. So, but if at any point that stressor is removed, then the parasympathetic system will come in, the endocrine system will calm down, and you will not be run into exhaustion. So the general adaptation system is important for you to know. It's important to you to know what will set it off. It's important to you for you to know what happens in the body. Okay, so we know what happens. We know that people get stressed. We know that stress can lead to illness, etc. Let's talk a little bit about your professional accountability. Okay, it is your responsibility to meet the healthcare needs of the patient in a self and caring way, and you need to apply your classroom learning and theory and your lab hands-on experience in your clinical setting when you get there. Okay, we expect you to be learning now before we get to the bedside, so that when you get to the bedside, you can recognize these things. And your accountability entails a commitment to stay current and knowledgeable. As a PN, you can delegate to other people. In case you haven't figured out, we've moved on to chapter 3. Okay. All right. You can, a delegation is assignment of nursing duties to another person. So the assignment of vital signs to your PCAs or your STNAs, that's delegation. Okay. In order to delegate something, you have to know that the person is trained to do it. They have to know what to do, when to do it, and what to report. And you need to monitor them. Okay. So you may supervise nursing assistants, you may supervise techs or other LPNs. Okay. And you can delegate to all of them. RNs delegate to LPNs. LPNs do not delegate to RNs. But when you delegate, it's a nurse's duty to supervise and evaluate the care that licensed and unlicensed persons provide. Okay, so all the patients under your care, it is your job to make sure they are being cared for properly. There is a professional discipline system in place if something would happen and the board would intervene in your actions. Okay, they're going to be responsible for disciplining within the nursing profession. Okay, so some of the most common charges you see are substance abuse, incompetence, and negligence. Okay, it is considered negligence not to report another professional's misconduct. So if you see something, you know of somebody abusing a patient, if you see somebody or suspect that they are under the influence of drugs or alcohol, if you see somebody being just totally incompetent, then you need to report it in order to protect your patients. Okay. This is an example. At one point, I was working in a facility as the director of nursing. We had a nurse that we suspected of deferring medications off site to other people. We don't believe she was taking them herself, but I do believe that she was taking them to sell. So, we had patients that only got Percocet when she was on duty, that kind of thing. And the patients told us they never got Percocet. So, we called the pharmacy, we called the police, we, started that whole process, but I neglected to call the board of nursing. Okay.
figuring, well, sooner or later, they're gonna catch up with her, right? Wrong. The Board of Nursing called me and they asked me why I did not report this to the Board of Nursing when I reported it to the police and the pharmacy. And I said, well, I wasn't really sure. I didn't want to, ruin a reputation with the board. And they told me that that was not my decision to make, that that was their job to make that decision, and that I should have reported her, and that if this happens again, I will be under disciplinary action by the Board of Nursing. Okay? You don't ever want to be on that list. You do not want to be on that list at the Board of Nursing. So it scared the living bejesus out of me. And from then on, I, towed the line. And regardless of what my personal feelings were, I reported people to the Board of Nursing when they needed to be reported. So it's important not to get yourself in that situation. Okay, not to be considered negligent because you're not reporting somebody else's misconduct. And to this, you don't have to report to the Board of Nursing. You're going to report to your supervisor, and they're going to report to their supervisor. And eventually, somebody's going to report it to the Ohio Department of Health and the Board of Nursing. Okay. We have laws that require continuing education after you pass your licensing exam. And like I said, you need to do 24 hours over a 2-year period. Okay. They do not require you to send in proof when you renew your license, but they can call and audit you at any time. So always keep your CEUs in a very safe place that you can get your hands on quickly, so that if they do audit you, you'll be able to provide that information in the time frame they're looking for. So there's lots of laws and guidelines that affect your nursing practice. Some of these you're going to recognize, like who knows what OSHA is? Anybody ever deal with OSHA? Yeah, Heather does, huh? When you're working in a facility, OSHA comes up quite frequently, doesn't it? So, Child Abuse Prevention Act, patient rights, all those things. So OSHA, or your Occupational Safety and Health Administration, are actually protecting you. They are actually putting in regulations to protect the employees, okay? Handling infectious toxic material. They're the ones that got the gloves in the rooms back in the early 90s, late 80s, okay? They're the ones that got the safeties on the needles, all right? Because they, put a regulation in that said that the facility needs to provide these. And if they don't, we're going to fine you. So obviously, in order to avoid the fine, they paid the extra cost and got the gloves and the needles and all those things. You always have to have orientation and education and things like bloodborne pathogen, exposure, fire bombs, lifting. It's all in your orientation, no matter where you start. Okay, and a lot of places you need to do this every year. So this is required. And the facility needs to keep records of hazardous substances and material data safety sheets, which tell you what to do in case there is a poisoning or a spill or something like that. Child Abuse Prevention and Treatment Act. Any act or failure to act that results in the imminent risk of serious harm, death, serious physical or emotional harm, sexual abuse, or exploitation of a child by a parent or caretaker who's responsible for the child's welfare is child abuse and neglect. Okay, you are required by law to report this. So if you suspect that there is child abuse, you need to report it immediately to your supervisor. Discrimination, we are not allowed to discriminate, and we went over that when we were talking about our ethics and our national standards, right? You cannot make a decision about treat a person based on class or group in which they belong, race, religion, sex, orientation, or other individual qualities, okay? You take your patients as they come and you treat them all with respect. It is also illegal for employers to ask questions on employment applications that would indicate race, age, health status, things like that. All right. Sexual harassment or unwelcome sexual advances. Okay. It is illegal to use sexual harassment as a condition of employment or promotion. If you are in a situation where you feel you are being sexually harassed, the first step is to tell the person who is harassing you to stop. If they do not stop, then you report it to HR or your supervisor. Good Samaritan laws, and somebody asked the question, Chandra asked this question, is it legal for me to do things outside of work, like to help my friends and family or in an accident? Good Samaritan laws will protect you from liability if you stop to provide aid in an emergency, as long as you are maintaining your standards of practice. As an LPN, you're not going to be able to do roadside surgery, right? Okay. You can put pressure on a wound. All right. You can stabilize a neck. You cannot go ahead and put in a tracheotomy. Okay. Your liability is limited unless there is evidence of gross negligence or intentional misconduct. All right. So you can help anybody as long as you stay within your scope of practice. And your scope of practice is not to diagnose, it is not to tell somebody what to get for, what kind of medication to get for a certain condition. Your scope of practice is, I think you need to talk to your provider. That's the phrase you use with all your friends and family, because the minute they find out you're a nurse, they want you to diagnose and take care of all their problems, okay? If it's something that they're worried about, they need to ask their provider. You cannot give them that information. All right, patients have rights, and this is an ethical document, all right? It is not a legal document. There's a difference between ethics and legal. Ethics are voluntary, legal is mandatory, okay? But this is how we preserve a patient's dignity, freedom, privacy, and information needs. And there are laws written in the legislature to guarantee particular rights. Okay, so it is almost 11 o'clock. We are going to take a 10-minute break. So come back at 11:10, get a good stretch and some good oxygen in you, maybe a little coffee, because I see people fading off here. So get energized, we're almost done, okay?
Hey guys, can you hear me?
Yeah, yeah.
Was there a problem?
Yeah, this good morning.
Yeah, I'm not getting no one.
Um, I don't even know who is speaking. Who am I speaking with?
It's Fatu. What's the other people?
We're on
Um,
break right now.
we're on break. We're coming back in about 7 minutes.
Oh, okay. I'm sorry, my internet is a problem.
Yeah, that's okay. Are we coming back 10 after 11 or what time are we coming back? Yeah, I guess we're on break about 10 minutes. So 5 minutes is almost gone. So
Okay, everybody ready? We're almost done here. Honest. Seems like a lot, but we're almost done. So, National Patient Safety Goals. These are developed by the Joint Commission, and the Joint Commission is an organization that is responsible for care, quality care in all hospitals and most skilled nursing facilities, okay? And they come up with new patient safety goals every year, and you can see those on their website. But they are applied to nearly 15,000 hospitals and healthcare organizations that are accredited by the Joint Commission. So these provide evidence and expert-based solutions to problems in terms of patient safety. And what they worry about are sentinel events. Sentinel event is an unexpected patient care event that results in death or serious injury or risk thereof to the patient. So, med errors, falls, neglect and not changing dressings, infections, those kind of things are all sentinel events. All right. And the most frequent cause of these sentinel events is lack of communication among caregivers. For instance, you're working your shift and you notice that Sally has been a little squirrely. She's been getting up and down all day. She's a high risk fall person. You know, she hasn't been able to sit still. So maybe you do pass this on to your nurse coming on duty after you. Maybe you do tell her that, you know, you got your analysis, you've talked to the doctor, but she does not give that information to the techs or the aides that are on the floor. Okay. So half hour into the shift, Sally's on the floor because nobody's paying attention to her. They're not giving her the extra care that she needs. That is an example of lack of communication causing that fall. All right. So lack of communication among caregivers is the most frequent cause when they get down to the root cause of a sentinel event. So how do we communicate? We have a format for communication. In nursing, it's called SBAR. All right. SBAR. And this is how professionals communicate with each other. Say you're calling the doctor, okay? You're waking him up at 2 in the morning. The first thing we're going to say is, hi, my name is, I'm taking care of so-and-so patient, and this is the situation. Give them the information on why you're calling them right up front. Or you give your nurse when you're doing shift change, you're going to give them the most important situation going on right now, okay? So that's situation. Then after we do the situation, we're going to give a little background on that patient. You know, they were admitted 2 days ago, they've had surgery, pain has been under control up until now, things like that. Then we're going to give our assessments, okay? Blood pressure is elevated. We've not been able, their pain is now a 7 out of 10. Even after I've given the pain medicine, you know, they are sweating, they're uncomfortable, they're restless, all right? And then our recommendation, and this is not telling anybody what to do. This is not telling the doctor, but you called the doctor for a reason, right? What did you want when you called them? You got to have that in your mind. So maybe we need a new pain medicine, or maybe we need an x-ray. Maybe we need to get a CT scan or a VE scan. See, maybe we have a blood clot somewhere that's keeping that area from getting relief from the pain medicine, okay? So you want to give them something, some idea of why you called. Now, we're not going to tell them you have to do this, but we are going to say, we thought maybe you would want to order, or we thought maybe this would be a good idea, or do you think we can do this? Okay. So SBAR, situation, background, assessment, and recommendation. Now, you will also see SBAR as SPBARR, so that after you've gotten an order from your physician here, you read it back to him exactly as he told it to you, okay? exactly as the provider said it, you read it back just to verify that you have heard him correctly, that they, realize what they ordered, and you document that you did a read back. The other thing up here is there's an I for introduce, which I think is, you're going to introduce yourself anyhow, but okay, so you also will see IS bar. But these are the basics here, SBAR. Okay. Negligence and malpractice. What's negligence?
Are you asking?
Yes, I'm asking.
Basically, my own understanding, negligence has to do with failing to do your responsibility or failing to properly cater to a patient.
Very good. Yes, it's failing to do something, and these are the legal terms. Reasonably prudent person would do, or something a reasonably prudent person would not do, is negligence. Okay, so let's say you're working night shift, and you've had a really bad day. You just didn't get a sleep, anything like that. Your techs and aides are sitting over there watching the Tonight Show and the all-night movies, and nobody takes care of the patients until about 5 o'clock in the morning. Is that negligence?
Yes.
Yes.
Okay, on whose part?
On the nurse part or on the caregiver part?
On the nurse part. Okay, because the nurse is responsible for supervising the techs, right?
Mm-hmm.
So you have to make sure other people are doing their job so you don't get accused of negligence. All right. Now, malpractice is nothing more than negligence by somebody with a license, negligence by a professional person. Somebody who does not have a license, you can't charge them with malpractice. All right. You can charge them with negligence, but you can't bring a malpractice suit against somebody who does not have a license. Okay. So malpractice is negligence by a professional person. All right. And there are 4 things that absolutely need to happen in order to have, or elements you need to have in order for you to have malpractice. The first one is a duty. The person had to have a duty to take care of that patient. And then you have to prove that there was a breach of duty, that they didn't take care of that patient. You have to determine that what they did caused an injury and that there was an actual injury. There are 4 things that must be present for a malpractice suit to take place. This is why when a malpractice suit comes along, they generally ask for the chart, and they have nurses look through the chart to make sure that you've done everything that you should, or where you are not acting according to professional standards as a reasonably prudent professional would. Okay, so it's a nurse who determines whether they have enough evidence to bring a malpractice suit. Okay, and they base that on your documentation. Okay. We do not have on-campus lab today. All right. So your medical record or your chart is a legal document that records all the care that you gave your patient, your assessment, your tests, the care provided. All of that is in your chart, which is a legal document, which is why the attorneys can ask for it. We keep it confidential. Only the people directly associated with the care of that patient have legal access to the information. So if you're at the hospital and you're doing clinical and you see Urban Meyer coming down the hall, going to therapy or whatever, if you're not Urban Meyer's nurse, you have no right pulling that chart to find out why Urban Meyer is there, right? That's a HIPAA violation. All right. And the chart or the medical record is property of the hospital or the agency or the physician, not the patient. A lot of patients believe that the chart belongs to them and that you'll just hand it over to them. That's not going to happen. If they want a copy of their chart, they can make a copy, okay? But it does not have to be provided immediately. You have up to 48 hours to provide a copy of that chart. And in order for anybody else to see that chart, the patient has to sign a release form for like the attorneys or anybody else to look at it. So your charting should be focused on the care that you have provided. And we need to document all the care. We document all our medications. We document the vital signs. We document all our dressing changes. We document everything we've done. We document our patient education. We document, because if it wasn't documented, it wasn't done. You could have spent all day with that patient doing things. But if you didn't write it down, it didn't happen in legal terms. Okay? Who's familiar with HIPAA? Who's familiar with HIPAA? Anybody who works in healthcare is familiar with HIPAA, okay? It's the Health Insurance Portability and Accountability Act, but it's basically regulations regarding patient privacy, okay? Failure to comply with the HIPAA standards will give you civil penalties and jail time. So fines and jail time. So it's very important that you comply with the rules of HIPAA. Means we're not going to share patient information with anybody else that is not authorized to get that information, and the patient has to authorize people to get information. Okay. So consent is a legal document that records the patient's permission. Your informed consent before surgery is extremely important. Nobody can do surgery without informed consent because the person signing that knows all the information. They have to know what the surgery is for, what the outcome's going to be, what the possible side effects of the surgery is, what the possible negative outcomes, who's going to be involved. All of that is included in informed consent, okay? So if they have made a knowledgeable decision, they can sign the informed consent. A release is a legal form to excuse one party from liability. So if you have a patient who decides to leave against medical advice, we always have them sign a AMA form, okay? That refers them to the consequences of leaving without a doctor's discharge, okay? There may be other forms or releases that you have that you can use to sign that. It is never a good idea to witness a will or other legal document because if those documents are contested in court, you will be called into court to testify to the patient's health and mental condition or relationship to visitors. And you're not even going to remember the patient at that point, okay? So most hospital and healthcare agencies have policy against witnessing documents. Advanced directives allow you to plan for communication of medical wishes if you're unable to do so yourself. And here is the important part. If unable to do so themselves, they're unconscious, they've had a stroke, they are not competent to make a decision, okay? So that gives us the information that what they would have done if they could tell us. That's your advanced directive. This includes your DNR orders. This includes whether they want a feeding tube or not. This includes whether they want to be on a ventilator. All kinds of wishes are on your advanced directives. One of those is the durable power of attorney for healthcare. For healthcare, not just a durable power of attorney. The durable power of attorney would give them power to sell the house and do their banking. That's not what we're looking for. We're looking for the healthcare power of attorney. Okay? And that's the person chosen by the patient to follow the patient's advanced directives and make medical decisions on their behalf. Hopefully they've talked to each other about some of these before that comes down. So there are some common legal issues you're going to run into as a nurse.
One of which is that you have access to all kinds of private information and personal contact information. You have social security numbers, you have Medicare numbers, you have all kinds of information in that chart. Okay, you are legally required to protect that information. We do not use that information. We do not sell that information. Okay, if legal boundaries are violated, then nurses may be subject to litigation. Okay, so that is one type of common legal issue. Here's a couple of terms you need to know. Assault and battery, everybody thinks of them as together, but assault is the threat to harm somebody. Even to threaten to touch another person without that person's permission is assault. Battery is when we actually make physical contact. Okay, so I usually think of that as I'm using a baseball bat, that means I've made physical contact. Okay, and that's been refused or is carried out against the person's will. So assault and battery often go together, but you can have both things are charged separately. Defamation is when you make remarks about another person that are untrue, and that those remarks damage the other person's reputation. There's two types. We can defame somebody by slander or talking about them. Slander, speech go together. Or libel, which is a written document. I mean, you write a note, you write something in social media, anything you write down can be libel. Invasion of privacy. This is a violation of confidential and privileged nature of professional relationship. So unauthorized persons learn of a patient's history, condition, or treatment from a professional. And this includes your family. We can't go home and talk about our patients, even in clinical, all right? If we're talking about your patients in clinical, we never use names, we can use initials, we never give identifying information. And we never leave the patient in a position that might cause loss of dignity or embarrassment. False imprisonment prevents a person from leaving or restricting movements in the facility. So if you lock them in their room, if you actually restrain them without an order, okay? There are times when we have involuntary admissions that are made against the patient's wishes, but that is to protect them or others from harm. And that's only for like 48 hours before they can leave, okay? But we give them 48 hours to get treatment before then. So protective devices is another word for restraints. And the inappropriate use of a device that limits a person's mobility can result in charges of false imprisonment. Okay, so protective devices and false imprisonment go together. It can be mechanical or chemical. Who can think of some chemical restraints? What do I mean by chemical?
Tranquilizers.
Tranquilizers, yes, sleeping pills. Those are all chemical restraints. If they are not ordered or they're not appropriate at that time, they can be a chemical restraint. So you need a physician order for any protective device. Before we get a physician order, we have to try every other possibility to take care of this situation before we get the physician order. And then once we get the physician order, it needs to tell us what restraint we're needing. Okay. We need to, we need to have an order to remove every 2 hours for hygiene or range of motion or circulation. And then we're going to check them every 30 minutes for safety, because people in protective devices tend to try and get out of protective devices, and it can lead to dangerous situations, including strangulation. Okay, so your order has to have the restraint, and it's got to be specific. It has to say for how long or what the situation we're using it is. We have to have an order to remove that restraint every 2 hours for hygiene, range of motion, circulation reasons. And we have to check that patient every 30 minutes and document that we did all these things, okay, to make sure they're safe. Okay, everybody got that?
Yes.
So how do we decrease our legal risk? First of all, you have to maintain competency. You need to maintain your education. You need to spend a lot of time learning about nursing, okay? We also use incidents or occurrence reports. Incidents or occurrence reports are just documents for your quality assurance committee to look at the issue and figure out how we can avoid it in the future. The one thing about this is we never, ever, 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 ever put in our nurse's note that we filled out an incident report. Okay, that does not need to be in your nurse's note. Remember, your nurse's note is a legal document. And if you put in your legal document that we have a report that goes to our quality assurance committee, that opens up the attorney's ability to go into our quality assurance notes and look at all the problems in the hospital. Okay, so we never mention incident reports in our notes. We do document exactly what happened, what we did, the patient's condition, all of that. We don't try and hide anything. We just don't state that there's an incident report related to this issue. And the third thing is liability insurance. Liability insurance is not expensive. It's like $100 for $300,000 to $1 million coverage. Because if you do end up having a malpractice suit, they can take everything you own and then some. Okay, so this protects you from losing all of your assets in a malpractice suit. A lot of them will also give you an attorney to go to the Board of Nursing with. So if you get called before the Board of Nursing, you can have an attorney. But you have to remember is your employer will say, well, we have liability insurance. Yes, they do, but their liability insurance is to protect them. Okay, and if there's any reason they can get off the hook by throwing you under the bus, they will do that. Okay, so please, consider getting your own liability insurance once you've graduated. Standards of care, and like we talked before, it's a way of judging whether the quality and effectiveness of standards of care. So we have the Nurse Practice Act, we have the NFLPN standards, all right? And then in legal cases, they help determine whether the nurse acted correctly. So it's always important to know exactly what your policy and procedure is before you do anything. You need to have the skill, knowledge, and experience necessary to provide adequate care. You need to document everything you do. And lawsuits can be avoided by early identification of dissatisfied patients. If you can take care of the issue when it's happening, generally they're not going to go and get an attorney after they leave. Okay, you need to get a rapport with your patients. You need to be able to have them trust you so that they are not unhappy with their care, because dissatisfied patients are the ones that bring lawsuits. Okay, we talked about incident reports. These are documents that document occurrences that are out of the ordinary. Tells us what happened, who was involved, who witnessed it, and we do not file as part of the chart. Talked about that already. Ethics. Ethics are rules of conduct that have been agreed upon by a particular group. They are voluntary. Laws are mandatory. Ethics are voluntary. Now, obviously, we're hoping that as a nurse, you're going to follow the ethics that are written out in nursing, okay? But it is not mandatory. So it's a respect for human dignity, the individual, and the provision of nursing care that is not affected by race, religion, lifestyle, or culture. It's a commitment to continuing education and nurse-patient confidentiality and relationships. Okay. So things that are professional and protect the public. That's what our code of ethics brings us. You are going to run into some ethical dilemmas as a nurse. Depending on your setting, you may run into more than others. But things like life prolonging treatment versus refusing such treatment, the patient has the right to refuse treatment. Okay, so it is up to the nurse to be an advocate for the patient. Okay, initiating or terminating life support or treatment is an ethical dilemma in many cases. You know, and you may have your own feelings about life support for people who are terminal or terminating life support once they're put on it, but you are always an advocate for the patient. Okay, and our personal feelings need to be put aside. Assisted suicide and euthanasia are not legal in Ohio. They are legal in other states. Okay, assisted suicide is when you give somebody the medication they need to end their life, and euthanasia is when you administer medication that they would need to end their life. And don't forget, there is a difference between giving somebody a dose of morphine for pain control, because the purpose is to control pain, as opposed to giving somebody a dose of morphine to stop their breathing and kill them. Okay, there is a difference between those two. And taking care of pain is a very ethical thing you can do. Giving somebody a little extra morphine to stop their breathing and put them out of their misery is not. It is against the law. Okay. Any questions? Any questions? I mean, I went through that whole 2 hours and nobody has any questions?
Yeah, I have a question about
Yes.
the giving of the medicine. So like, you know, those medicines you were just talking about, the ones that's, you know, if you give too much of a dose or anything like that, like when we're finished with the degree, we'll be certified to give medicine, right?
Yes, you will. You will have medication certification on your license. LPNs have to be certified for medication administration and IVs, and you will be certified for both.
Okay, and what about the dangerous ones? Like, is there a specific, like, do you need to be looked over while giving this specific medicine, or is it just like, you know?
It is always a good idea that if you are giving a high risk medication like insulin, anticoagulants, opioids, that you have it double checked by a second nurse. Just make sure you have the right dose. Okay. As an LPN, you're not going to be able to give chemo or a lot of the cardiac medications because that's out of your scope of practice. Okay. There are certain medications you can administer IV and some that you can't. So yes, you need to know what your scope of practice is.
Okay.
Any other questions? All set for your test now? How are we going to study for our quiz?
I mean, I would say to like read through those chapters that you gave us, study the questions at the back of the book. And I had a question as well. Do we use this book or no? Because
Yes, that's your textbook. Oh, that's your study guide.
yeah, because
right?
these questions that I was, that's what I was confused about. Are we supposed to do the review questions for the NCLEX examination, the questions at the back of this book, the textbook, or are we supposed to do the ones that's inside, or both?
Well, you could do both, but the ones that we're talking about are the ones that are at the end of the chapter, like on page. Well, let's look at a chapter here. So if you open your book to page one, Nursing and Healthcare, chapter 1, your book has objectives, and these are the things that after you're done with this chapter, you should know. Okay. We also have student objectives and course objectives on your syllabus. All right. Then under that, we have what we call key terms. This is the language of nursing. All right. So, you need to know what aseptically means. You need to know what capitated means. You need to know about the nursing process. You need to know about what interventions are. Okay. These are words, they're in blue. They are highlighted in the text and you have page numbers next to them so you can look them up. These are good things to put on index cards with your flashcards, okay? Because this is the language of nursing and you're going to learn a lot of new terms, okay? Then you're going to go through the chapter, and if nothing else, you're going to look at the chapter headings. You're going to look at the pictures. You're going to look at the charts. Anything they pull out into a chart or a box or a picture, that's something you need to pay attention to. So if you look on page, and we didn't do that one, but box 1-1 on page 6. Okay, there's the standards of practice for licensed practical nurses. This is a lot what we talked about this is part of what is in Appendix B that we went through, okay? So this is important because they pulled it out and put it in there for you, okay?
So I have a question.
Yes?
Is our quiz on the 19th, next Tuesday?
Yes.
And that's also the next time we'll have class with you?
For class, yes. You're going to have lab with me this week too.
Okay, thank you.
Okay. So yes, you want to look at all the boxes. You want to know what's in the boxes. Now I'm talking about studying for the test now. All right. And then at the very end of the chapter, you have a section that says, get ready for the NCLEX examination. It lists key points that are in this chapter. Those are what you need to know about. And I'm not talking about we need to memorize. I'm talking about how am I going to apply this? So, standard of nursing practice protects the nurse, the patient, healthcare agency where the nurse practices. Okay, that's pretty straightforward. But if I had a question that said, what document protects the public? What would you answer?
Nurse Practice Act.
The Nurse Practice Act. Okay, your questions on your exams are not going to be written word for word. Memorization is not going to help. Okay, what's going to help is talking about these issues, talking about these with your family, with your cohort here, your nursing buddies here in your class, okay, on your WhatsApp app, getting together in a group chat. These are things that are going to help you because the more you can use this information, the better off you're going to be on the exam, okay? So you have the key points, and then for your quizzes, you want to do the review questions for the NCLEX exam that are in this book. So on page 12, we have question number 1, okay? So do all those questions, know what those answers are.
Can we see the
Very,
questions?
very
The book?
helpful for the test. The what? The
Can
book.
we see the book? Oh, okay.
The big fat
Do
one,
the same
okay?
one.
Not the study guide. The book, textbook,
Okay.
okay? So those will all be very, very, very important to you when you're taking your quiz. And those of you who have taken this class before know what I'm talking about. All right, so your quiz on Tuesday will be on chapters 1, 2, and 3, which is what we talked about. I put the PowerPoint out in the chat. Okay, I will put it in announcements later today so that you will have access to that. But don't forget the basic PowerPoint is also in Canvas. All right.
I also have a question about the other readings that we have to do for the math. I think that's what it's called, the math
Yeah.
book, the purple book. Is those due this week too as well, or do we have time?
Those are just like a quick, when I said be engaged, be prepared. That's just going through the book to see what we're going to talk about. I'm not expecting you to know that word by word. We will go over the math problems in lab, okay? And we'll go through the book in lab, all right? So yes, chapters 1, 2, and 3 for your quiz. Know your terms, all right? So 4 to 12. So that is that. Any questions about class today? Any questions about Canvas? Any questions about quizzes?
Will the exam be multiple choice or is it?
It's multiple choice. Okay. We also have reviews that are going to start next week. Well, they may start Friday, probably start Friday. Okay. On the material that we went over this week, that will be on the quiz and the test. Okay. So
Can you
this
provide
Friday from
example with
1,
that information?
this Friday from 1 to 3 on
Okay.
campus. Okay. There is a live review with Ms. Kaplan. Also on Friday from 4:30 to 5:30, there will be an online review with me. Okay. So, whatever you can attend is great. Do not forget about the workshops that are available for you on test taking and studying, and the College U courses that the Dean of Nursing is providing. Okay, those are all things that are going to do nothing but help you. Find time in your schedule to go to those. All right. All right. So who has lab today? Chandra, who else?
I still don't know if I have lab.
All right, let me tell you who has lab today.
Yeah, me too.
Let me tell you who I have in lab group A and B, I believe. So on your schedule, if it says you have lab today, it'll be from 1 to 5.
Yeah. So I think I have lab today.
Yeah.
Okay. So let me get the list up here. Now, I have not gotten an official list, but this is what they put up for me. So DeConte, Shamari, Fatu, Aaron Castle, Whitney DeClout, Michaela Flynn, Mackenzie Hicks, Menumatu, Chandra, Jessica, Habiba, Hani, and Gady. You all have lab today. The rest of
Thank
you
you.
have lab on Thursday.
Some information for the lab.
Information for the lab, I will send out the Zoom links because I'm not sure they're working on Canvas like they should.
Okay.
So yes, we have a separate Zoom link for lab.
Mm-hmm.
All right. And the reason I have the separate links is makes it easier for me to verify who was here, who wasn't, who did what. Okay. These are all recorded so that, we have the ability to go back and look and see what we did that day. So any other questions? All righty, so I will see those of you in lab at 1 o'clock. The rest of you I will see on Thursday at 10 a.m. All right. So while we're doing basically this week, we'll do hand washing, but that's the only lab skill. The rest of it's all math. We have 5 chapters of math to cover. It'll be basic review. You guys will know it. It'll be fine.
So for lab on Thursday, is it 10 a.m. in the morning?
10 a.m. to 2 p.m.
Okay. Thank you.
Okay. Anything else? Okay, well, you're free to go. I'm going to hang out here for a few minutes if anybody has any questions or issues that they need taken care of. But otherwise, I'll see you in lab.
I have a question. Did you say you was gonna send the PowerPoint?
Did I what? I put PowerPoint in the chat. PowerPoint's in the chat, and I will put it in announcements.
Okay. Thank you.
Okay, Professor Novak, I did not still receive the email for Canvas. I don't know exactly who I need to be talking to about the,
Okay, you need to go to the Student Success Center, so you would be calling Alexis or Jacob. Have you talked to
see, I
them yet?
emailed Alexis last week because, yeah, it's a long story, but I emailed Alexis last week about Microsoft. She still hasn't got back with me on that.
Okay, she's a little overwhelmed. I will poke her and send her your way today, okay?
Okay, thank you.
You're welcome. Anything else?
For math, I know you said that we have assignments due before lab. So do we have anything due before the lab on Thursday?
No, no homework whatsoever.
Okay, thank you.
You're welcome.
Professor Novak, about our quizzes. Do we have any preparation to do for the quizzes? Because I missed the first half of the class this morning due to I
Okay.
can't log in with I was struggling with campus and my email
Oh,
address.
I understand that, yes. Okay, what we recommend for the quiz is that you do the NCLEX questions at the end of the chapter. So review the chapters and do the NCLEX questions on all 3 chapters.
Is it the NCLEX PN examination? The Saunders?
No,
Is that
no, in your textbook. In your textbook. That's this book here. Okay, fundamentals, concepts.
I can see it. They see it?
You see it? Okay. On page, you start chapter 1's questions, I believe, are on page 12. Yeah, there's 8 questions there for you to answer. So review the material and answer the questions on chapters 1, 2, and 3. That's the best way to study for the quiz. Okay.
Thank you. Thank
You're
you.
welcome. Anybody else? Menumatu? Have a question? So I'm gonna, yeah. Chandra, do you have a question? Okay, you can leave. And Charles, do you have a question? You have to unmute yourself.
Yes, Prof, I do have a question. I think somehow along the line, I was lost about how we can do the quiz on a part. Can you help me? I wanted to find out whether we have to create the ELF's book online first before, with a code first before we can access the
Okay.
test.
Okay. So you're gonna go into Canvas. I'm gonna share my screen here so you can see what I'm doing.
Okay.
All right, so you're gonna go into your class.
Mm-hmm.
Come on, you can do it. All right, so you're going into the PNR 104 class.
Okay, this one, yeah.
You're gonna go to modules.
Okay.
And yours is gonna look a little different, but you go to your student resources.
Okay.
And under your reference package, you will see your Saunders Comprehensive Review for the NCLEX PN.
Yes, please. Mm-hmm.
All right, you're gonna click on that.
Mm-hmm.
It's going to, you gotta load it in. Now mine's
Mm-hmm.
gonna open up because I've already put my code in. But when you do
Okay.
this, it's going to ask you for an access code, and that access code is on the inside cover of this
Of the
book,
book.
the PN
Yeah.
book.
Yeah,
Okay,
I've seen that.
the big fat one, not the skinny one. All right, it's on the inside cover at the bottom.
Mm-hmm.
You put that in. It may ask you to log into Evolve. Go ahead and, put your information in, and then you
Okay.
will be able to get to your NCLEX questions.
Okay. So I think that was where I got stuck with the Evolve. Initially, I had created one for myself, and I don't know whether it still can be used or I have to use the one with the Fortis name on it, like my first name, my last name at my .Fortis.
I think you're going to have to use your Fortis one.
Okay.
Okay. That way everything's connected.
Okay. 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 Okay.
Okay.
So when I do that, it will bring me to this point, right?
Yes. And then you're going to go to quiz.
Mm-hmm.
All right. You're going to see your book. This is just information. You go to continue.
Mm-hmm.
So we're going to do 25 questions.
Okay. 25 questions.
And if you look under your assignment, it's going to tell you what it is we're going to choose. So this first one, we're going to choose priority concepts.
Okay.
That's your category. And then your subcategory is going to be under professional nurses. And then you're going to click the little caret next to attributes and role of a nurse.
Mm-hmm.
And then you will check professionalism
Mm-hmm.
and health promotion.
Okay.
Okay, then you begin your session.
Okay, so
That'll
it's under
take you through questions.
professionalism and health promotion.
Yes.
Okay. Okay. I
All
get
right.
that.
Okay, after you answer all your questions, you're going to go back to your home and they'll take you back to this page and it'll say history.
Okay.
Click on history. Click on the one you just did.
Okay.
It's going to bring up your results.
Mm-hmm.
You are going to print your results to a PDF.
Okay, print results to PDF.
Yes. So save as a PDF and save. Okay, somewhere you remember. And then I want you to go back through all the questions that you missed. All right, we're going to review. So it says incorrect. Okay, this is what I picked, the one with the little dot. The correct answer has the check on it. Go to the rationale, read the rationale, and get the information you needed to answer that question. So it's the outdoor construction worker because of the prolonged exposure to the sun or cold or the conditions. Okay. So you're going to write that one sentence down on a piece of paper and you're going to upload your rationales or your remediation with that page that had your scores on it.
Okay.
Okay. And you're going to upload that at the homework link. Let me get back here. You can get there through syllabus. Do this in order to get this to show up. As soon as it goes into student view for you. There we go. Okay. So you'll see all your assignments.
Okay.
All right. So this would be the one that you were going to upload. You're going to click on that. And here where it says submit assignment, you're going to click on that. And it's going to give you the option to upload your file.
Okay. Okay.
You'll upload both the files with your rationales and your scores, and it'll go directly into your grade book. Okay. And we can grade it.
Okay. Thank you
Make
very
more
much.
sense now?
Yeah. And please,
Okay,
one more
good.
last thing.
Okay.
Okay. So I see a record button here. Am I allowed to do a recording?
You are.
So that maybe. Okay. Yeah.
But
Maybe
I'm
so that.
already recording it, so yeah.
Oh, okay. 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 I would love to have that one because today I couldn't
Okay,
do
yeah,
that.
I post those. I have a YouTube channel that I post all this stuff to once a week, so it'll be there.
Okay. Bye. Thank you,
Mhm.
Prof.
You're welcome.
Okay. Bye.
Anybody else have any questions?
What's your YouTube name, Professor Novak?
I'll send you the link. It's PNR104.
Thank you. See you
Okay.
then. See you then on Thursday.
See you on Thursday. All right, I'm going to end the meeting.